Hi, everyone. Welcome to SOAR's COVID and Cancer video series, episode 6. And today we're interviewing Dana Dornsife. I'm Claire Q, the medical liaison of SOAR.
And I'm Rahul Mathilaka, the CCO of SOAR. This series was created to talk about the issues surrounding COVID-19 and its effects on the cancer community through different conversations with oncologists, survivors, nurses, etc., and their experiences during the pandemic. We encourage everyone watching to donate to help us combat the economic effects of COVID at donorbox.org/SOARBUFF. All of the donations we receive up until August 15th will go directly to the Greater Houston COVID-19 Recovery Fund to aid those in need of food assistance, affordable childcare, and basic financial hardship caused by COVID-19. As stated earlier, today's guest is Dana Dornsife, the founder of Lazarex Cancer Foundation, a nonprofit which improves the outcome of cancer care, giving hope, dignity, and life to advanced stage cancer patients and the medically underserved. Hi, Dana.
Hello. Thanks for
Hello.
inviting me to join you in this conversation today.
Thank you.
No problem. Yeah, thank you.
So why don't we begin by asking you to briefly introduce yourself and why you decided to start your nonprofit?
Sure. My name is Dana Dornsife. I am the founder and CEO of Lazarex Cancer Foundation. We're located in the San Francisco Bay Area, California, but we actually engage with patients from every state in the country and nationwide activity. And I started Lazarex Cancer Foundation as a result of a personal experience with cancer in my family. And that experience actually uncovered, the challenges around a cancer diagnosis, what happens when standard of care doesn't work. In our case, it was pancreatic cancer. And, the outcome for pancreatic cancer really isn't very good. And so it really forced us to look into clinical trials for my brother-in-law, Mike, and all the challenges around clinical trials. First identifying the trial opportunities, getting in touch with the people, getting them enrolled, and then ultimately actually having to constantly reach in our pockets to cover the associated costs. And I realized that the only reason Mike was able to participate in a clinical trial was because he had a family who could support him through the process. And I really felt that all people, all cancer patients should be able to participate in trials. And that was the genesis behind Lazarex Cancer Foundation.
Nice. Thank you.
Yeah. So now, how has COVID affected your work at Lazarex? Like, are you all virtual now, or what's happening here?
Well, we're very fortunate that, California was one of the early adopters of shelter in place. And within 24 hours, we were all able to transition to work from home. And since we don't actually have patients coming to our office, we do everything via technology anyway. It was actually a very seamless transition for us. So we were able to continue to serve our patients uninterrupted and still be safe and sheltering in place.
Okay.
You mentioned that that you do some sort of clinical trial. Are the clinical trials still going on, or how has that been affected?
Yeah, so Lazarex doesn't actually do clinical trials, but what we do is we're kind of the bridge between people who want to participate in trials and the clinical trials that are going on out there. So we help patients identify the opportunities that would be appropriate for them in clinical trials, and then we actually provide the financial assistance to them so they can get where they need to be and when they need to be there. COVID-19 has presented some interesting challenges around clinical trials for patients in that the vast majority of sites, medical sites who are participating in clinical trials stopped. They did not begin any new trials. They suspended a lot of existing trials. they were not enrolling new patients in existing trials. And they really kept a very bare bones clinical trials program going for those patients who were really considered at risk if they weren't allowed to. So it's really for those patients who, chemotherapy, radiation isn't working, clinical trials represent a lifeline for them, and they haven't been able to take advantage of that lifeline.
Do you have any personal experiences with the patients and survivors that you help, and how are you seeing them be affected by COVID-19? Is there anything carrying over from people who started before who are now not able to continue, or anything like that?
So fortunately, we've kept in touch with about 20 of our patients who were participating in trials and who were able to continue participating in their trial. And for those patients, the difference, before COVID and after, is that their clinical trials have been what's called decentralized, and they've been actually able to continue to participate by getting their labs and diagnostics done locally instead of having to travel to the clinical trial site. A lot of the sites, if they're on an oral medication, they'll just FedEx it or mail it to them so they don't have to come in. For some of the treatments, they've been able to transition to having their treatments administered locally by an oncologist in their area. And then for others, they still do have to go to the site for an infusion for their clinical trial. And what used to take 8 hours, from start to finish, a lot of the checkups and the things that would normally happen are being done via telemedicine. And so the actual amount of time that they're spending at the clinic is very, very, short, an hour, 2 hours, really minimal to, really keep their exposure to COVID-19 down since they're immunocompromised.
Yeah. Generally, then, like, things are able to keep going pretty well. So that's very nice to hear.
Yeah, I think a lot of things, there are some silver linings that have come out of the whole COVID-19 experience. One of those is decentralizing these trials. Now we know we can do it.
Yeah.
We know we can reduce the burden on patients who are participating in clinical trials. So we really want to see that continue once our, challenges around COVID-19 resolve.
Yeah.
Yeah, we saw that Lazarus Cancer Foundation recently participated in a summit talking about COVID-19 and how it affected the clinical trials. Can you talk more about some of these effects?
Sure. So, I think the biggest effect, well, it's twofold. First and foremost is closing down the clinical research enterprises at a lot of the comprehensive cancer centers and other centers who are conducting clinical trials. That's not good. I mean, a person who needs access to a clinical trial to live, they need to have access to those clinical trials, right? And so we went from 100% operation, down to maybe 10%. And, we were just starting to ramp things back up again. And then, we kind of had another surge of COVID, especially here in the state of California. So they're starting to ramp down again. So it's really very unfortunate from an access perspective. But I do think that for those patients who were able to continue, they benefited from being able to stay at home, stay local, and reduce the amount of exposure that they would have had before COVID.
So then, I guess in relation, can you also talk about the advocacy for increasing availability of home treatments?
Sure. For a cancer patient, when they're going through treatment, they're emotionally spent, physically spent, financially, cancer infiltrates every aspect of your life,
Mm-hmm.
and it also infiltrates every aspect of your family, right? And your support network. And so being able to participate in a potentially life-saving or life-extending clinical trial and do it from within your own environment becomes so important. Really helps to reduce the burden on patients of having to spend their entire day, when they're already tired and, getting in the car, driving 3 hours, spending 4 hours at the clinical trial site, getting back in your car, getting home, you're exhausted, right? Especially if you're in a situation where you have young children, or you have elderly parents maybe living with you, and you're a primary caregiver for them, right? So I really, this decentralization and being able to bring trials to where the patients are instead of bringing the patients to the trial it's really it's a great opportunity for us to reduce the burden on patients, increase the efficiency of the clinical trial process, and hopefully, get more patients enrolled in clinical trials so we can get drugs to market faster.
That sounds really great. This all seems like a lot of money involved. So how has fundraising changed after COVID?
Well, we have a pretty balanced fundraising portfolio. So we have sponsors and grants from, corporations and foundations. We have individual donors who support us. But, that other aspect of our fundraising, which is events, has really been shut down. So we've had to transition to having virtual events, and it has impacted our ability to create new relationships, new opportunities, but also to stay in face-to-face personal contact with those donors who can allow us to continue with our programs. So we've been fortunate in that most of our donors, grants, et cetera, we've been able to maintain those. But we have had it's been a bit of a downturn. But also for us, we've had fewer patients who are needing our assistance because of the situation with the clinical trial shutdown. So I hate to say, we're doing okay, but honestly, it's at the expense of those patients who really do need to have access to clinical trials.
Mm-hmm.
Yeah. Do you see that there will be any long-term effects for your nonprofit after COVID is all done?
Well, one of the happy side effects, I think, is that people realize that, it's you don't always have to have face-to-face meetings. So a lot of us are able to, I'm hoping we won't have to travel as much. So we'll be able to recapture some of that time and use it for, more hours of fundraising, more hours of generating revenue opportunities for LazarX, and honestly, just more hours to devote to supporting our patients.
That's good to hear. That it won't be all bad. Now this, I'm just curious about this. Do you see home clinical trials becoming maybe not the norm, but closer to it happening more often because of COVID? Is it better for patients to have home trials now, since is it safer for them with COVID?
So yeah, so absolutely safer, yes, with the existence of COVID-19. But honestly, I think it's better for them in general. Now, there are some trials that absolutely cannot be done at home. There's a degree of monitoring that has to take place, and you need to have access to high level medical equipment in the event that somebody has a bad reaction. to a clinical trial drug. So those trials will probably never be done at home. But, I would say there are aspects of the majority of clinical trials that really can be done at home. And there's a big push to keep things moving in that direction. In the industry, we've been talking about, decentralizing or virtual clinical trials for years, but it never got done. And then COVID forced our hand, and we had to make it happen in order to help, keep cancer patients alive and on their trials. And so now we know that we can. And, we just have to continue that trend once the challenges around COVID-19 subside.
Yeah, it seems really
like a great improvement to quality of life for a lot of these patients, possibly.
Definitely. And their families.
Yeah.
It's very assuring to hear.
Yeah, awesome. Less money involved,
Yeah, exactly.
Well, great. Unless, Claire, you have anything else that you want to ask about?
Other than making a push to like home clinical trials, what other projects have your nonprofit really dug into as a result of COVID?
I would say that, there are a couple aspects of, COVID-19 that have really raised some red flags for us. So the first one is the obvious health disparities that are present here in our country, given, for various reasons, but and also the disproportionate number of diagnoses and deaths of COVID-19 amongst our communities of color. And we've always focused on improving access to cancer clinical trials for communities, members of communities of color, and improving the diversity of cancer clinical trials participants. But now more than ever, we have to dig in on that. People now know, I'm sure you guys hear the words clinical trials all the time, right? Because everybody's clamoring to get a COVID-19 vaccine. They're all in clinical trials, right? So now everybody knows what clinical trials are. And unfortunately, everyone knows the effect that health disparities can have. And so we feel like it's our opportunity right now to capitalize on those things and to really, carry that torch and really try to make a difference for health disparities overall and equitable access.
Yeah, that sounds very benevolent of you. That is all the questions I have.
Yeah.
Raul?
Yeah, thank you, Dana, for informing us. I know I actually have learned quite a bit about clinical trials. I mean, growing up, I always heard about how scary they were, and I didn't really hear much about how impactful they can be and how positive that they can be. And learning about Lazarus Cancer Foundation has definitely taught me a lot about how it shouldn't be such a scary stigma, and how more positive I should be looking at it. And I'm sure a lot of other people have had the same mentality with it. And so I really do thank you for coming here with us today to kind of share some knowledge and information.
Well, thank you. This is great. I mean, you guys are the next generation. You are our hope. So I'm, really, I don't know you obviously, but, I'm proud of you for doing what you're doing, and just best to you.
Thank you.
And SOAR and stay in touch with us.
Yes, we'll do. To you as well.
Yes, for sure.
Thank you.
Thank you so much.
Okay, take care now. Have a good day.
You too.
You too.